Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Julia Townsend, and Carlos Saracedo is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. We are at a crossroads with the COVID-19 pandemic. It has been 128 days since Governor Newsom issued his statewide stay-at-home order to combat the coronavirus pandemic. The state of California led the nation with this early response to the rapidly increasing COVID-19 cases around the state. Working together, we successfully flattened the infection curve and preserved our hospital capacity, avoiding the catastrophic overflowing emergency rooms that Italy and New York City experienced. Unfortunately, the virus was not sufficiently contained by these forceful initial efforts, and as businesses have reopened in California, the virus reignited and is now threatening the progress that we initially made together. Across the country, new COVID-19 cases are increasing significantly. Texas and Florida are being especially hard hit right now. Houston emergency rooms today look strikingly like New York City in late March. This week, the state of California passed New York as the state with the most COVID-19 deaths. Governor Newsom announced today that 34 counties, and as soon as this weekend, 36 counties, containing 90% of the population of the state of California are now on the state monitoring list because of COVID-19 cases that are rising too fast. Fortunately, Santa Barbara County has weathered the pandemic better than larger urban areas. Our local hospital capacity continues to be prudently managed by the collaborative working relationships between Santa Barbara and Goleta Cottage Hospitals, Lompoc Valley Medical Center, and Marion Regional Medical Center in Santa Maria. While our local hospital capacity is currently manageable, new COVID-19 cases in Santa Barbara County continue to increase, and the trend is not good. We can't go on indefinitely like this without students in school and businesses unable to stay open without restrictions. We know enough about COVID-19 now to know what to do. Masks are the safe choice and an easy choice. We must reduce our case count in order to get students back to school, all of us back to work, and return to living normal lives. I challenge each of us to play a role in taking action to bring down our case count. I'll take a few minutes to illustrate the challenge by looking in detail at some of our local numbers. As of today, we averaged 121 new cases each day over the past week. The state requirement of 25 cases per 100,000 population over a 14-day period, when applied to Santa Barbara County's nearly 450,000 residents, works out to only 8 new cases per day countywide. I'll say those two numbers again. This past week, we have averaged 121 positive cases per day. The state requirement is an average of 8 new cases per day. Looking back at the numbers since Memorial Day, we've experienced a steady increase from 13 cases per day the week of Memorial Day, rising to 25 per day 2 weeks later. A month after Memorial Day, the number had risen to 60 new cases each day. 6 weeks after Memorial Day, the number had grown to 96 new cases per day. This week, 2 months after Memorial Day, the average number of new cases per day has now grown to 121. I'll repeat those numbers to emphasize this point. The week leading up to Memorial Day, Santa Barbara County averaged 13 new COVID cases per day. That number increased to 25 new cases 2 weeks later. The number again increased to 60 a month later, then increased to 96 6 weeks later. Now, 2 months after Memorial Day, the average daily case count for the past week is 121. The goal is clear. We must reduce the number of cases. The strategy to reach our shared goal remains the same. Wear a mask, stay 6 feet apart, wash your hands, limit contacts. We can reduce the spread of the virus in half by the end of August if we all work together. If each of us does a little bit more, if each of us focuses a little bit more on our own daily actions, we can turn around the number of increasing cases and regain control of our future. Now we'll hear from Ms. Paige Batson, the Public Health Department's Deputy Director of Community Health.
Thank you, Supervisor Hunt. Today we are reporting 133 new cases of COVID-19. We currently have 362 active cases in our community, and 4,565 of 5,179 community cases have fully recovered. Currently, 85 people are hospitalized, with 26 in the intensive care unit. We've received many questions about how we qualify a case as active or recovered. Active cases are defined as being less than 10 days from symptom onset or by lab collection date for those individuals that may not have symptoms. These are identified cases that are still considered to be infectious. Recovered cases are those that are past their infectious period. This means 10 days have passed since symptom onset or lab collection date, and the individual has also not had a fever for 24 hours and overall symptoms have resolved. Note that prior criteria required being fever-free for 72 hours. Today, that CDC now has changed that to 24 hours. We have shared previously about the delays we've seen in getting results, and this is one of the main reasons we see so many cases recovered and so few active cases reported. The California Department of Public Health continues to closely monitor counties for elevated disease transmission, increasing hospitalization, and limited hospital capacity. Santa Barbara County has been on the state monitoring list for nearly 40 days. Currently, we continue to see elevated disease transmission as indicated by our average case rate during the last 14 days and our testing positivity rate of 9.7%. Our increase in cases and positivity do remain elevated and are consistent when compared to last week. The increasing case count we are seeing by no means tells the full story, yet does continue to keep us on the state's monitoring list. From the cases that we have investigated, we know that 1,637, or 29%, are person-to-person spread in the community. 1,011, or 18%, are from person-to-person spread in the prison. 12, or 21%, from travel outside the county, and 1,012, 18%, are community acquired. The key ways that COVID is spreading in our community is through gatherings, which are occurring with people outside of the same household. This includes backyard barbecues, extended family celebrations, and other gatherings. And when person-to-person contact occurs in a confined space, which means being less than 6 feet apart for more than 15 minutes without face coverings, when around others outside of your immediate household, it is best to assume all people might be positive. As there are many questions on contact tracing, and because this is such an important part of stopping the spread of COVID-19, I would like to share some information on contact tracing. Public Health currently has between 70 to 85 contact tracers, and we reach an average of 250 cases and contact calls daily. The average time it takes from the receipt of a positive test result to contacting a positive case, it takes us approximately 2.1 days. All positive cases are called by contact tracers, as well as those identified as having had close contact with that person. While contact tracers are not able to reach a small percent of those testing positive, 94% of people who test positive are actually interviewed by a contact tracer. Contact tracers use interview questions within a script provided by the state Department of Public Health. In closing, our only defense is social distancing, wearing a mask and washing our hands. These efforts can stop the spread of disease and are key to breaking the chain of infection. Please consider this. If we cannot impact the path of disease by taking very simple actions as individuals, broader actions that will impact our community will need to be taken. During this weekend, we ask every community member to stay close to home and do your best to avoid closed spaces, crowds, and close contact with those that live outside your home. Enjoy time with those who live in your household. Stay 6 feet apart from others when outside your home. Wear a face covering and wash your hands. Thank you.
Thank you, Ms. Batson. We also have Dr. Jethro Ritter, the infectious disease specialist for Marion Medical Center in Santa Maria, on the phone. Dr. Ritter, you are on the front lines of the medical response to the COVID-19 pandemic in Santa Maria. Can you help share some of your observations and experiences in that regard?
Of course, I'd be honored to. Thank you again for allowing me to speak with the group this afternoon. So as you mentioned, my name is Trace Ritter. I'm an infectious diseases subspecialist. I also am the one of the chief medical officers for Marion Regional Medical Center. And so I've been able to be a part of both the administrative response as well as the medical staff response to this pandemic. You know, as an infectious disease specialist, this was something that we've been prepared to do, but always hoped we would never have to do. You know, so, and you know, in Santa Maria, we have been, I would say, disproportionately impacted by the COVID pandemic when you compare the different communities within the county of Santa Barbara. And there's probably a number of different reasons for that. But we are continuing to care for a number of patients in our hospital that are sick with COVID. Over the past month, we have probably averaged in the high 40s to low 50s as far as the total number of inpatients in our hospital with COVID. And those are typically people that have respiratory illness that is so bad that they require supplemental oxygen. When they get worse than that, they often require movement into our intensive care unit, and sometimes they require intubation and mechanical ventilation. And over the past month or so, we've had an average of 20 to 22 patients in our intensive care unit, and up to 16 or 17 patients on ventilators at any given time. So that's sort of the big picture view of what's happening at Marion Regional Medical Center in Santa Maria, and I'd be happy to answer any additional questions that people might have.
Well, I know that there will be questions from the reporters, so please, thank you very much for joining us today, and we will look forward to those questions and answers. Suzanne Grimacy is also here today with a message from the Department of Behavioral Wellness and the Community Wellness Team. Welcome, Ms. Grimacy.
Thank you, Supervisor Hart. Good afternoon. We have been at this a long time. Stress is being felt throughout our community by individuals, business owners, parents, first responders, healthcare workers, essential workers, and those that are a part of the city and county emergency operations. And everyone is tired. Not just physically tired, but emotionally burnt out. Stress creates exhaustion, both emotionally and physically. Stress from homeschooling kids and the worry of how the fall school year will begin. People feeling lonely and isolated from staying at home to prevent exposure to COVID. Worry felt from loved ones who are either home or in the hospital sick with COVID or other illnesses and are isolated from others in family or in a nursing home environment. Tremendous stress and worry is felt by business owners, struggling to keep their businesses operating with unpredictable and frequent changes in guidelines. worry of business owners who have lost tremendous income while continuing to support their families, and the worry of others who fear they may lose their jobs. Normal plans for summer vacations and times to recharge individually and with families have either been canceled or changed considerably. For many, the idea of taking a true vacation or an extended break is not anywhere on the horizon right now, both for the general community as well as those in leadership roles in the response to the pandemic. And we are all tired. Being tired impacts many things, including being irritable or short with ourselves or others. This is an important time to remember extra patience with ourselves and with others. The ongoing nature of the pandemic is affecting everyone's mental health in both small and large ways. The current realization that we are going to be in this for a long time has now set in. In addition, the uncertainty and the constant changes are also likely to continue. This makes it hard to get used to a new normal, as we may have done with other disasters, as the new normal continues to change. One of the greatest risks this presents to our mental health is the dropping of our routines that keep us mentally and physically healthy. When life gets chaotic, it's normal to go off course with routines a bit. Knowing we are in this for the long haul, we must find ways to balance our mental and our physical health. Some tips for things we can do to take care of ourselves are: develop routines which carve out time for your physical and mental health. Make time to unwind. Find time to take a break with family, even if it's a non-working staycation. Don't dwell on the news, but stay up to date. Check a couple of trustworthy sources just a couple times a day. Acknowledge how you are feeling. For example, what we are experiencing now is unprecedented. No wonder I'm feeling anxious and stressed, and that's okay. Stay connected with others and reach out for support when needed. In addition, keep your eye on the silver linings as we continue through this together. Some may be feeling a sense of pride in enduring and living through the crisis of a pandemic, and this builds resilience. Some may realize they are much stronger than they thought when reflecting back on just what they've been through over the last 5-6 months. This builds resilience. And some are lending time to support others. This builds resilience. In closing, be extra patient and kind with yourself and others right now. We're in this together, and we will be for some time. We are learning together. Our moods are changing together. Nobody is alone. If you're feeling stressed, frustrated, your sleep is impacted, this is all normal under the circumstances. By prioritizing our self-care right now, we will gain even greater strength as an entire community. And lastly, be sure to reach out for the support of others when needed. Of friends, of families, a family. The community wellness team remains available to call and get connected to mental health resources or just someone to talk to. That number is 805-364-2750. Thank you.
Thank you, Ms. Grimacy, for the important and practical message about how we can all manage the frustration and fatigue that we're feeling. We'll now go to questions from the room. Mr. Devine?
Supervisor Hart, just to start off, you mentioned that you believe we could have this pandemic under reasonable control by mid-August. If that were to happen, what do you think needs to change between now and then?
Well, that would be fantastic. Under control by mid-August. I was actually being a little less ambitious and hoping that we could have the average case rate by the end of August, because I think as a practical matter, this is so significant and so serious a situation that we find ourselves in that we're really all going to have to bear down to achieve that goal. And by doing that, we can, see the finish line potentially at that point and actually begin to reopen schools and hope that we get to a point where businesses are more stabilized. But it is not an easy task to achieve, and it will require the persistent, focused attention of every person in this county. And I sense that people are feeling that as well. As I go around in the community with my daily routine, I'm astonished by the increasing number of people who are wearing masks, and that's only a positive. But we all incrementally need to do more in our own daily interactions. If there are little things that we have thought were not consequential, but we're doing, even though we probably recognize that was outside of the direction of the health officials, we should tailor that and trim that and get really back on track, because we need to arrest the trend of increasing cases in order to get to a place of stability.
In Santa Barbara specifically, what is your advice for people using outdoor gyms now that the gyms are closed? If you drive by the beach, you see the fitness equipment at Cabrillo Ballpark, the pull-up bars at Dwight Murphy Park. There's people there without masks, working out, getting sun, obviously, but what's your advice for how they can safely do that and still get their physical activity?
Well, I think it's very important to get physical activity, and that is a part of the overall health message that Ms. Grimacy spoke to, mental health and physical health. But if there's any question at all, and I think there probably always is a question, wear a mask. Just default to a mask. There's no reason why you can't exercise wearing a mask. And if you're close to somebody or have the possibility of being close to somebody, take the protective stance of doing the right thing, protecting yourself and others by wearing a mask.
Similar to that, at that Cabrillo Ballpark, there's been soccer games been going on since March, even before gyms were closed. Has there been any enforcement with physical distancing at that park specifically?
I'm not aware of what the city of Santa Barbara has done in regards to specific parks. I do know that the city council is going to be discussing those issues on the Tuesday meeting, and any contribution from any of the local agencies that we're partners with throughout the county is welcomed and appreciated.
Thank you.
Thank you, Mr. Devine. Are there questions on the phone?
Yes, the first is Tom Bolton with Newshawk, to be followed by Delaney Smith with Santa Barbara Independent.
Thank you. I have a couple of questions for Ms. Batson to start out with. I'm wondering, you talked about contact tracing, and I'm wondering how forthcoming people are. Do you feel like you're really getting the information you need? Are people sometimes hesitant to, say, admit that, yeah, we had a big family party or what have you?
Well, we certainly hear some hesitancy, but as we have very skilled interviewers that are able to elicit that. But yes, we are definitely feeling some hesitancy when it comes to asking those specific questions, because most people know what the answer is. Avoid these crowds and make sure you're social distancing. So yes, the answer is yes.
So they know they're supposed to do that, but for whatever reasons, they're sometimes choosing not to. Is that correct?
And,
Okay.
I think that's
Second question relates
Bolton,
to
let me just pause you.
testing.
Let me
I'm sorry?
just pause you for a second. I think that raises a really good point. All of us want to do the right thing, and sometimes we make choices that aren't the perfect choice. And that's just human nature, and we want people to make the right choice. But if you make a mistake and you're in that situation and you get a call from a contact tracer, don't think of it as a moment of judgment or blame. This is an opportunity to help the effort, the collective effort that we're all trying to be engaged in to stop the spread of the virus. And so please cooperate with the contact tracers. Number one, answer the phone call. That's important. and it is not in any way a judgment about you and your behavior. And two, please be forthcoming and share that information. The quicker we can get to other people that you may have had contact with to explain the situation, the faster we can resolve those kind of outbreaks. And thank you for asking that question, Mr. Bolton.
Sure. My second question pertains to testing. It's been clear that in recent weeks, there's been significant delays both in being able to schedule tests as well as in getting test results. And I'm wondering, and maybe I think this is for Dr. Batson or Ms. Batson, but also for Mr. Hart. How much are those delays in testing and results affecting our ability to slow this disease? And where are we in terms of improving that situation?
So, yes, there has been a backlog in getting test results for a number of reasons. One, for example, using the state system at one point was causing delays of between 3 and 5 days. That has since improved, and we are now receiving real-time data. In terms of some of the other labs that are backlogged, it does impact our ability to reach out and initiate our contact tracing. However, we have our medical health professionals they actually help in dealing with this by when they decide to test somebody who's perhaps infectious or not infectious, but symptomatic, by advising them to self-isolate until they receive their results. So we do receive a lot of help from our medical community when individuals are being tested and advised to stay at home. But certainly it does impact our ability to get out there and provide a comprehensive contact tracing.
Where are we in terms of actually improving that situation?
Well, I think we're working really hard at trying to identify different labs, reaching out and prioritizing too. That's the other important piece here, is that recently the California Department of Public Health issued some new guidelines with respect to prioritizing testing so that we can ensure that individuals that are hospitalized, that are contacts, that are symptomatic receive first priority. And I will tell you, with most labs, individuals in those priority groups, our turnaround time can be anywhere from 1 to 2 days turnaround. So that has really helped with us being able to intervene early with individuals that are potentially infectious.
Okay, thank you. And then my last question is for Dr. Ritter. I really appreciate you providing some information about Marion's situation. Marion, of course, has had the bulk of the COVID patients hospitalized in the county. Cottage Health puts out a very helpful daily update on their facilities and their COVID patients, et cetera. And I'm wondering what the prospects are for getting something similar from Marion. We've sort of made that request before, but it has not happened.
I can work with our leaders to help provide the community with that. I mean, I think that I don't want to make excuses, but we've been very busy caring for patients and protecting our employees. But I think that it's certainly appropriate for our hospital to release a similar metrics on a daily basis. I will work on that for you.
Well, I'd greatly appreciate that. I really think it's a really important information and helping reinforce all the points that the folks you all are making today. And I think when people see those numbers, it makes a real difference. So I thank you for that commitment.
Yeah, thank you.
Thank you very much.
Thank you, Mr. Bolton.
And next, we're going to Delaney Smith with Santa Barbara Independent.
Hi. Most of these are going to be for Greg. I kind of wanted to ask about enforcement, particularly with masks. I know that the city of Santa Barbara has kind of been thinking about enforcing wearing a mask in outdoor spaces like on Lower State Street. Is the county kind of thinking about doing something bigger and really going harder with enforcement and not just relying on education? I know that I think Monterey, Calabasas, and Hollywood are all actually enforcing wearing masks. Are we at that tipping point yet?
Yes, I think the city of Santa Barbara is going to have a discussion about this on the council agenda on Tuesday, And we're going to be talking with them and collaborating and working toward a regional strategy. But enforcement of individual people wearing masks or not wearing masks is extraordinarily difficult and presents challenges and potential confrontations that are ultimately very difficult to manage. And I think we are going to be more productive as a community if we focus on the positive education message that we are all in this together, that the consequences of our individual actions have a cumulative serious effect on all of us, and imploring people and asking people to think about the consequences of their actions through persuasion and encouragement, rather than a punitive, confrontational approach, is going to serve us better in the long run. This is not something that can be resolved by punishing people. We need to encourage people to do the right thing and to work together collaboratively.
Okay. And then switching gears, look, but I still think this is kind of a question for you, Greg. The majority of cases are in Santa Maria. And I was curious what efforts, if any, are being made to provide individuals safe and affordable or perhaps even free housing where they can quarantine, since so many families in Santa Maria do live in a multi-generational household.
It's a great question, and we are actively working now to expand the number of hotel rooms and other housing options in North County to make sure that we have the capacity to accommodate people who need to be quarantined. We do have a sufficient capacity now, but anticipating ahead, worrying about increasing numbers of cases, we are taking active steps to increase the number of those options.
Okay. Thank you so much. That's about all I have.
Thank you, Ms. Smith.
We'll go to the next. I've just lost my mouse here for a second. Thank you, Delaney. Next, we're going to Annika with KCOI KEYT.
Hello, yes. My first question is for Mr. Hart. What are recent or planned efforts by the county to reach farm workers or prevent farm worker infection, particularly in Santa Maria?
The county's agricultural commissioner is working directly with farmers in North County, providing information on a regular basis. The agricultural commissioner's office has a database of all the farmers who are actively working in our community and growing crops, and so they are providing regular, up to the minute information to all of those growers. They're meeting with them on a regular basis as well, to particularly folks who have questions and concerns. And the Public Health Department is also working with stakeholder groups in the agricultural community to get the best information available, both to the growers so that they can pass it on to their employees, and directly to farm workers as well, so that they can be safe in their jobs. Those are essential workers that deserve the most protection that we can provide. And we are committed to doing that, working with community organizations to do outreach, targeted outreach in neighborhoods where there are large numbers of farm workers living, in addition to the H-2A employees who are living in employer-provided housing. Those facilities are being inspected, and excellent collaboration is going on between the Department of Public Health and those employers.
And just to clarify on that, as far as languages shared, I know the county's been sharing information in Mixteco, Spanish, and English. Are there other indigenous languages that you're also sharing information in, or the agricultural commissioner?
I do not personally know the answer to that question. I believe that there are other languages provided in regards to outreach effort. We're trying to target every population that would need that. Ms. Grimacy?
Yeah, I might be able to help. So in Santa Barbara County, as I think most people know, our threshold language is Spanish. So we make sure that all information is provided in English and Spanish. And because of the density of Mixteco-speaking individuals in the ag community, we also provide videos in different ways, different ways to get the information in Mixteco. But the call center number which is available to anyone, has use of the language line. So it has the ability to get interpreters in any language spoken by the callers that call in. So we would encourage anyone with questions or need for information, or even businesses to help with their attestation process, to call the call center number.
And this next question is for Dr. Ritter. Farm workers, at least on the last report I saw, were affected disproportionately to other occupations in Santa Maria itself. I'm wondering if you could explain why that might be happening.
Sure. Well, so it's a number of different reasons. The number one reason is probably, these are essential workers who didn't have the luxury of staying home. And so they've continued to go to work. Many of them carpool with other individuals, and the circumstances by which they live and work and live their lives is a bit more crowded than most other people. And so with density of people comes an increased rate of disease transmission, unfortunately.
Got it. Thank you so much.
Yeah.
Thank you, Annika. We have several more. Next, we're going to Raisa with San Ynez Valley Star, to be followed by Laura Place with Santa Maria Times and Nick Welsh from The Independent. Go ahead, Raisa.
Hi. Sorry, I was unmuting. This question is for either Ms. Batson or Dr. Ritter, but how do you identify the COVID-19 virus from the typical coronavirus cold? And do you have any oversight as county public health to check whether or not these laboratories are not giving out false positives or false negatives? There was a report published on MSN a few days ago saying that the CDC testings were finding a 30% false positive rate and a 20% false negative rate. So I just want to make sure that our tests that are being done are actually accurate and what oversight we have over those tests.
So I will start, and then I'll let Dr. Ritter respond. So first of all, there is a specific test for COVID-19 that would distinguish between a regular cold virus and identify the COVID-19 virus. So that's the first thing. In terms of the false positive, false negative reports that you may be hearing about, there are different platforms that are used in different labs, and obviously there's a lot of quality assurance that goes with that. So it has not been our experience of seeing any of finding that tests are actually false positive or false negative. So, Dr. Ritter, do you want to add to that?
Of course. So the differentiation between the SARS-CoV-2 virus, which is the cause of COVID-19, and seasonal coronaviruses, the primers that are used for the molecular testing, which is the PCR testing that we do to identify this, are very specific, and there is no cross-reactivity between seasonal coronaviruses and the SARS-CoV-2 virus. Early on, when they were developing an antibody test, there are two different types of antibodies: an IgM antibody, which is an early antibody, and an IgG antibody, which is a late antibody. Some of the early tests had some cross-reactivity with the IgM, or the early antibody, and the medical community has come to a consensus that using that for diagnosis is not something that should be done, and nobody is doing that. Paige mentioned that there are different platforms that do PCRs, and at Marion we actually have 6 different platforms. We saw this coming and made an early investment so that we could stay in front of the testing. We have 6 different platforms, and anytime that there is a suspicion that the result that we're getting may not match with what we call our pre-test probability, meaning that if somebody comes in and it looks like COVID and your test is negative, that would mean that your pre-test probability for that test was high, and you would want to validate that result. And we've taken to validating a small number of these on different machines, and have found that our false positive and false negative rates are very, very low. I mean, you mentioned numbers around 20 or 30%, but ours are more like 1 or 2% from the data that we've gathered. We're all familiar with one of the machines called the Abbott ID Now, which that was the one that was being used in the White House. And that one is prone to higher false negative rates, meaning somebody has the disease, but your test comes back negative. And that's sort of the most dangerous type of test to have, because what you don't want is somebody walking around in the community who actually has the disease, who's been told by a physician after running a test that they don't actually have the disease.
Right. And then what specifically is Marion doing with patients that are coming in? I've asked this question of Cottage Hospital, but what kind of treatments are you using? Are you using the corticosteroids, the inhalers, budesonide, prednisone, any of those to help with the respiratory issues?
Yeah, so we have developed treatment guidelines that we've tried to share with our emergency room physicians, our hospitalists that are the main admitting doctors for these, and then our intensivists who manage our intensive care unit. And the most important thing that we try to determine early on is how far through the patient's disease are they, because different therapeutics are more ideal at different stages of the illness. And so what we know is that very early on, there's a high level of virus circulating in the blood, resulting in a pneumonia. And if somebody is, ideally within the first week, they're an ideal candidate to be treated with an antiviral called remdesivir, which at the end of May was approved by the FDA under emergency use authorization, and we've had that supplied to us. And so early on, people are thought to get benefit from that if they've already moved past that phase of their illness where they're developing acute respiratory distress syndrome, or ARDS, where they're requiring significantly higher amounts of oxygen and or the ventilator. They're believed to not be ideal candidates for remdesivir, but more likely to benefit from anti-inflammatories like dexamethasone or prednisone or IL-6 inhibitors such as Actemra. And so every patient is different in the different therapeutics that are suited to their particular case.
Okay, and my last question is, I had someone today call me and say that they had made an appointment to go get tested in Santa Barbara County, and for whatever reason, they didn't get there in time and they couldn't get tested. A few days later, they got a result in the mail saying they were positive without being tested. So I'm hearing more and more things like this. So how is this even possible to be happening here?
Yes, that was brought to our attention, and we learned that was occurring with our public testing, and so we are currently looking into that. It wouldn't be possible if a person isn't tested. It would not be possible. So we are looking into that.
Thank you, Raisa. Next, we are going to Laura Place with Santa Maria Times.
Thank you. I have another question regarding skilled nursing facilities and investigations into their outbreaks when they have them. And it's something I've kind of questioned before, but I'm looking for a little more specificity on as far as investigations. Does an investigation of an outbreak at a nursing facility mean just testing and watching test results until there's been some consecutive weeks of no positive cases, or does it also mean looking into how the outbreak might have started and kind of, doing some like questioning of staff and all that? And if they do find that there was maybe some negligence or like lack of action, what are there like consequences for that, or would there be a report prepared? I'm just interested to know if the public will be able to hear a bit about what these investigations found.
Well, I can tell you that whenever we have a positive case in either a skilled nursing facility or a long-term care facility, there's a lot more to it than just serial testing that is being done and required. There is a lot of involvement with public health department, as there are investigators assigned to the case. They work very closely with the facility to identify whatever issues may be contributing to the outbreak. Also, state licensing is involved, and often they come in and visit and do site visits, as well as and other departments at the state will come. The infectious disease group will come out and do an assessment, and they look at different things as far as how they're housing, ensuring that the individuals are fit tested, that they have adequate PPE, that they look at their admission policy, their visitor policy. So it's really very comprehensive. It's not just the serial testing. They're looking at ways to mitigate and stop that infection.
Okay, thank you for specifying.
Thank you, Ms. Place.
Next, we're going to Nick Welsh with the Santa Barbara Independent. Nick, can you unmute? Nick. He may have stepped away. There you go.
Can you hear me?
There you
Yeah,
go.
can
Thank you.
All right. First, I just want to thank Dr. Ritter for showing up and giving that presentation. That was really good information. And I would really like to follow up on what Tom Bolton said, that if there's going to be more regular brain dumps from Marion, it would really help us paint the picture of what's going on in the county. I'd like to follow up on what Delaney asked about, which is city of Santa Barbara looks like it's going to pass something or is moving in the direction of adopting a enforcement on masks downtown Santa Barbara, at least, and all over. And the city of Monterey has adopted something like that. I think they have fines for as high as $1,000. But what I'm told is you have people in red shirts and khaki pants passing out masks to people who aren't using them in a very non-confrontational way, not cops with guns and tasers. And then they notify people that if they don't use the mask, that they are subject to a fine, and the fines go up. And I'm just wondering, I heard you very loud and clear there, Greg, but I'm just wondering, what research you've done on places like Monterey or North Hollywood or Calabasas, and do you have any sense of what works best and what works least in a enforcement situation, and what is really the downside, given the dire numbers that you outlined at the very beginning here?
Well, I think the answer is complex, because the way an enforcement strategy would work is through the authority of the local governments throughout the county. And so you will have decision makers at every single city council level, and obviously at the Board of Supervisors for the unincorporated portions of the county. And that will be a decision that each one of those legal entities has to make for themselves, and they'll have to decide, how to approach this issue, which employees are going to be issuing the citations. Is it going to be law enforcement? Is it going to be the ambassadors in the city of Santa Barbara's circumstances? What exactly is the behavior that we're trying to control? As you know, the governor's mask order applies to specific circumstances, in stores, in workplaces, in line, in public transportation, in rideshare services. It does not apply to outdoor situations. So we are encouraging people to wear masks whenever they are in potentially less than 6 feet distance of other people outdoors, just because it's easier to message that. It's important to get away from the ambiguities and to have people, make this message clear. If you're in contact with another person, indoors or outdoors, please wear a mask. But the governor's order doesn't make that standard. And that isn't the public health officer's order standard either. So there are a variety of complexities to turning this from an encouragement effort and a persuasion effort to an enforcement effort. When that trigger is reached and a local agency does make that choice, they also have to consider, what are the consequences of somebody refusing to participate in a coercive engagement. If someone is issued a ticket, what will happen if that person chooses not to sign that ticket? Are we going to arrest people? We have a challenge at the jail, and we don't have the capacity to accommodate that. We do not want to create violent conflicts between folks who are trying to intercede, trying to solve a problem, and in turn create another problem. So it is not a simple thing, and it is not a coincidence that the vast majority of jurisdictions around the state of California have not moved into an enforcement posture. The communities that I've read about that have said that they are moving into an enforcement posture have in fact not issued very many citations to do that, to accomplish that. And there's LA Times reporting on that. The communities, that have led the way in saying that they are going to do enforcement have in fact not written very many tickets. So maybe there's some kind of psychological benefit to making that threat, but as a practical matter, I don't think it truly is changing behavior. What will change behavior and is occurring, I question the premise that there are lots and lots of people walking around without masks when they should be wearing masks. Every store that I go to, every place that I go to, earlier this afternoon, I was sitting in front of the dry cleaners. A person got off their motorcycle, didn't have a mask on, looked like they were gonna go into the shop without a mask, reached in their pocket, put their mask on, and went about their business. And I see that increasing everywhere I go. Yes, there are people walking around on State Street in their minds far enough apart from other people that they don't need to wear a mask, despite the fact that the city has posted signs that say that they should be wearing masks. That may be a unique problem that requires a unique such solution. But I don't see a location in the Goleta Valley, in the Carbureto Valley, that replicates that environment and that situation that would require creating a coercive enforcement strategy to solve.
I hear you. I mean, I think that downtown, the promenade is sort of a public gathering in an open space, and it's sort of a little bit of both. And I guess I'm not clear. Are you saying that because the governor has not authorized the issuance of enforcing in open spaces like that, and the public health officer hasn't issued that order yet, the city of Santa Barbara is precluded from doing so?
No, I'm not saying that. In fact, the city of Santa Barbara absolutely has the authority to go farther than the public health officer and the governor's order, but that is their discretion.
Gotcha. Okay, thank you very much.
Thank you.
Thank you, Nick. And that concludes our question session.
Thank you for the questions today. Our next press conference will be next Tuesday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to practice these 3 simple personal steps every day. Remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home. Don't go to work and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Please continue to be diligent and focused on our shared responsibility to be safe while also being patient, considerate, and kind to each other. We are stronger together, safely apart. Thank you for joining us today.